Hi, my name is Dr. Hany Mohamed, and I'm a board-certified geriatric pharmacist. I've been practicing for over 20 years, and I specialize in long-term care, LTC. Currently, I am the Director of Clinical Services at a large vendor pharmacy in New York called LI Script. I work with about 40,000 residents, but I am mainly focused on clinical initiatives. For example, how can we optimize medication therapy management to improve health outcomes for long-term care or LTC residents? In LTC, the OAB disease state is really an interdisciplinary approach. Pharmacists, nursing staff, and medical staff work together to create an action plan. This includes what we are assessing and looking for, as well as which medications to use and which medications to avoid. My specific role is educating the whole team on the disease state in a pharmacological way. For example, I educate team members on the pros and cons of different medications. This includes side effects, drug interactions, formulation differences, and proper dosing. Our goal with any treatment is to optimize efficacy and minimize side effects, and I believe that the more awareness and education there is, the stronger the outcome. Proper education can help improve the quality of care for these patients. First, staff needs to look for proper documentation and assessment of symptoms. Most of these residents may have been recently hospitalized, and we want to make sure what's listed in their chart is accurate. For example, we often see that OAB is mistaken for a urinary tract infection. Therefore, it is important to first ensure we are treating the right condition. Second, I find that educating staff on the challenges associated with untreated OAB in the older population is key. I also educate staff to evaluate any comorbid conditions and concomitant medications patients may be taking that could impact treatment choice. For example, it is important to look for any potential drug-drug interactions and adverse reactions. Older patients with OAB are likely taking concomitant medications, some of which may be metabolized by CYP2D6 substrates. Finally, we look at the patient's overall health and condition, and also what is going to be accessible. Are they able to swallow? How mobile is the patient? Is the medication on formulary? These are all important questions when determining if medication is the right choice for a given scenario and, if so, which medication is the optimal choice for the patient. As a pharmacist in the LTC setting, my goals are patient-centric. In this population, it is especially important to optimize medication outcomes while considering comorbidities that may affect residents, drug-drug interactions, and the potential risk for adverse events. There are several reasons why I prefer Gemtesa for this patient population. First, the key OAB symptoms of urge urinary incontinence, urgency, and urinary frequency are prevalent in both women and men. Some men of which are often already being treated for benign prostatic hyperplasia, or BPH, in the LTC population. Gemtesa is the first and only beta-3 agonist with data for all three key symptoms of OAB in its label. Additionally, Gemtesa is now the first and only beta-3 agonist indicated for those three symptoms in men being pharmacologically treated for BPH. Second, Gemtesa does not interact with CYP2D6 substrates. Third, I recommend Gemtesa for patients who have underlying hypertension because it has no blood pressure warning in its label. Of note, in a 24-week study of OAB in men being treated for BPH, rates of hypertension were 9% with Gemtesa, which included 553 study participants, versus 8.3% with placebo, which included 551 study participants. Finally, in patients who cannot swallow, Gemtesa is optimal because it can be crushed and mixed with applesauce. It also needs to be taken just once daily.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.